Hi, welcome back to the Dr. AKINDE Breaks It Down video series. As you know, this information is, first of all, not considered to be medical advice. Instead, it's meant to be information so that it provides you an opportunity to see what's going on, especially with your child, since this is more of a pediatric focused series of topics. See what's going on with your child and make a decision about what you should do generally next. Of course, if anything seems to be an emergency, the best place to be is in an emergency room. And if anything seems to be urgent, it's a good idea to definitely call your healthcare provider and or go directly to them. This is information. This is meant to help the general person to understand so much of what's going on, because much of what's out there is misinformation, and it's good, I think, to have a general pediatrician or even a specialist, depending on the topic, to comment on different things to give you the best information that's needed. All right. So as is custom, I want to make sure that today we introduce the t-shirt that's being shown. This is a t-shirt that I bought, I don't know, 3, 4, maybe 5 years ago. It says Deep House, but then it says Japan, and then it says, looks like Deepu House, which is sounds to me like a Japanese pronunciation of Deep House. And I can't read Japanese yet, but I get the feeling that's probably what it says up here. Anyway, back to the topic at hand. This is an important topic, I think, today, especially during kind of the cold winter types of seasons, because I want to talk about ear infections today. Now, ear infections can be different places within the ear altogether. An ear infection can be an inner ear infection, which is the rarest one, and it involves kind of the balance apparatus inside the inner ear. So generally it can be caused by, of course, viral infections and even maybe some bacterial blood infections if it really gets deeply into that area. But for the most part, it involves things like balance and ringing in the ears and of course the inability to hear to whatever varying degrees there are. Those are really rare. They usually kind of show themselves in a different way. It's not as common as middle or outer ear infections, which is more the topic of focus today. So let's move on to a little bit less rare, a little bit more common than inner ear infections, the outer ear infections. The outer ear infections are what's generally known as swimmer's ear. That is essentially what has been known as when a person goes swimming in a lake or pond or any other body of water, and then they get an outer ear infection. It usually involves pain of the outer ear, this auricle, the pinna, the apparatus for being able to funnel the sound into the ear space. So that is anything that involves the ear, whereas it's continuous with the ear canal before you actually get to the eardrum, which starts the middle ear space. So the outer ear infection is essentially an infection of the skin of the ear canal. Normally, and I stress this, normally we make earwax. Earwax is normal and it's fine. Please don't go in after earwax. Don't go in, try to clean earwax with Q-tips or safety pins or hairpins or toothpicks or pen caps or erasers or anything else. It's amazing the stuff that we pull out of ears on a regular basis. So earwax is normal. However, of course, if you see that it's melting or kind of coming out and you want to really clean it, you can clean what you can see. Do not insert anything into the ear canal, please. And the reason is that it can lead to impacting of earwax, kind of packing it in further and preventing a kid from being able to hear. Also, whatever it is that you're using to try to clean could push all the way down into the eardrum It can poke a hole in the eardrum or perforate the eardrum. That can cause pain. That can also lead to infection, and it can damage the ear bones on the inside of the ear canal, of the eardrum, in the middle ear space. So it's really important to try to avoid putting anything into the ear canal. You don't know how far you're going. You can claim to be the most careful person in the world, but it's really difficult even for specialists. They use cameras and scopes and things like that in ENT offices just to be able to see properly what's in there. It's not an easy thing to do, and I don't ask for anybody. As a matter of fact, I ask people not to put anything into the ear canal. If you can clean what you can see with a washcloth or something like that, that's good enough. Don't worry about the rest of it. If we need to see in there, we may clean it out just enough to be able to see or something like that. So the bottom line is, ear infection of the outer ear is called otitis externa. That is an infection that involves the skin of the ear canal. The area can get infected from micro scratches that may lead to sweat, water of any kind, even shower water, that introduce bacteria into the skin of the ear canal. And so what then happens is that it's kind of like any infection of the skin in other areas. It just kind of gets soft and mushy. It becomes painful. The ear canal itself swells inward, so that no matter how big it was to start, then it gets more narrowed. That makes it more difficult to be able to hear, because you can't get quite as much sound to pass in through there. And then sometimes what will happen is you can get foul odor from an infection, kind of getting into the ear space. Getting into the ear canal from the infection in the ear canal. Sometimes it oozes out. Sometimes it involves bleeding. Sometimes it just has this kind of disgusting, mushy, oatmeal-looking kind of stuff that is in the ear and coming out. It can stain the pillows and bed sheets and clothing, and even drip a little bit of ooze down toward the ear and the neck, outside of the ear and then onto the neck. So these are all important things to know about the difference between an inner ear, an outer ear infection, inner ear and outer ear infection. And then also there's a middle ear infection, which is what we encounter, what we see at the office most of the time, involving kids. In part, the middle ear infection is more common based on the anatomy of the kid. A kid is smaller, so that their ears, their ear tubes, their ear spaces, and everything else is just smaller. Two, their immune systems are relatively naive. They haven't had as much time to have as many infections as adults have had. So, and then they're, as part of their anatomy as well, not only are their ear tubes smaller, but they're also angled differently. The ears are connected to the throat by these eustachian tubes, and the throat, of course, is connected to the nose. And so once inflammation starts with a cold and things like that, the inflammation can kind of spread to various parts. What can often happen is, as a result of colds or even from allergies and things that lead to inflammation of the nasal areas, the eustachian tube, which connects the ears to the back of the throat, can themselves get inflamed, and they narrow. And just like your nasal passages that narrow when you get inflammation, the eustachian tubes themselves narrow, and they don't drain the ears as well as they should. Well then, the ears then get backed up, essentially. They don't drain into the spaces they're supposed to. Bacteria sit there. They lead to an infection. So very often the symptoms that a kid feels are pain, fever. Sometimes you'll see ear pulling. Sometimes, just depending on the age, if the kid can't talk yet, they're usually more crabby, more clingy. Sometimes actually just giving them ibuprofen or Tylenol helps, because it takes away the pain. And so then the kid acts a little bit more comfortable. Another thing that can happen is that they may act like they can't hear you quite as much. And at any age, this can be difficult because kids, it's their job to test their parents and to challenge them, and to try to see if they can get away with things. So is this kid ignoring you on purpose, as they usually do, or is this something where they can't hear quite as well? And now you start yelling at the kid, and now they can hear you, and now they're upset, and now you're upset, and now everybody's upset, all because the kid has an ear infection. So please be patient. Sometimes the inability to hear, or at least a seeming inability to hear, is actually a reflection of something else that's going on. So please be patient with the kids. All right. So the bottom line is, if there's an ear infection, you may see some of these symptoms with the pain, ear pulling, clinginess, poor hearing, and all the rest of that. Usually it follows a bout of nasal congestion, because that kind of starts everything and it works its way up. Some kids will get recurrent ear infections over and over. Some of them will get chronic ear infections, in which case the ear infection never goes away. Essentially, it lasts for like 6 weeks, 2 months, or even longer. If that's the case, those kids may need to see an ear, nose, and throat specialist to evaluate for the need for different treatments, including antibiotics, which the primary care provider usually starts, or maybe an antihistamine to help kind of reduce the congestion in their nose if it's caused by allergies, and then the potential for ear tubes. I've asked plenty of families not to be against ear tubes before hearing from the ear, nose, and throat doc. And the reason simply is this: at the end of the process, when they actually do go through this, they say, oh my God, why didn't we do this sooner? It's like night and day. All these infections we sat up with the kid in the middle of the night through, now they're not getting it as much. So the ear tubes help. It's called a fenestration, which means you create a window essentially between the middle ear space and the outer ear space, and the air gets in there and dries things out. And if fluid builds up in the middle ear space, it can actually drain out. And that actually leads me to another potential symptom of a middle ear infections, which is eardrum perforation. That means that the eardrum itself can bulge so much with the fluid behind it that it pops. Sometimes what happens is that the kid is just a piece of work. They just are upset, they're crabby, they're in pain, and then all of a sudden, once the eardrum ruptures, they actually feel better from the pain being gone, from all that pressure that was built up. They feel a little better. That doesn't mean that the problem is completely solved, but it does mean that they can now actually just, kind of wind down and relax a little bit because they don't have all that pain and tension causing them to be so out of sorts. So that's another reason for us to see them. So if we see signs of an eardrum rupture, we can actually treat very often with the antibiotic directly through the eardrum that's ruptured, or through a tube if they've already gone through that. And we can put the medicine directly in there. You don't have to fight the kid for 2 or 3 times a day for up to 10 days with antibiotics. Instead, you put the drops in there. You have them kind of tilt their head down and hold the side that got the medicine up for probably about 5 minutes, just kind of lie down on the side or whatever and let gravity do the thing. And everything kind of drains in through the eardrum and into the space where it belongs. Middle ear infections that are ruptured, as well as outer ear infections, are treated by the same medicine, because the antibiotic drops go in and help to clear up the infection according to the course that's prescribed. So the key isn't necessarily worrying about which medicine and for how long. The key is, 1, pay attention to the symptoms that the kid is having. 2, have them seen if you feel like there's a reason based on the symptoms that they're having and how well they're doing. Kids are generally, of course, honest, and not like adults. Adults will tell you that they feel great when they don't, that they'll feel terrible when they feel fine. Kids generally tell you how they feel, and even if they're not saying it, they show it in some way. So it's really important to pay attention to their symptoms. And sometimes, you sneeze in one room and the kid claims that they have a cold. Watch them. If they're happy, if they're playing, if they're eating, if they're sleeping well, if they're bothering their siblings and you, they're generally doing fine. But, don't always go by that. If you see anything that's concerned, of course, have the kid seen so that we can help make a decision on how to help the kid. All right. So I think there we are. That is a quick breakdown of ear infections. Middle ear infections are the most common ones, as I said, followed by outer ear infections or swimmer's ear, and then of course inner ear infections, which we rarely see in general pediatrics. So this is Dr. Akinde signing off. Please remember to like, subscribe, and share this video. Really, and leave a comment. We really want to get, different topics that people are interested in as sources of focus and conversation. There are going to be times when we can do a live session with Q&A and things like that. We'll work on that in the future, and we'll just continue trying to make sure that we provide the best care that we can for children. And I think the good place to start that is with good information that people can work on. I know sometimes it's hard to have all this time with your primary care provider in the office. We can be busy at times, but I want you to know that I'm out here trying to make sure that we get you this information, that also you feel like if you have any questions or concerns that it's addressed and we're heeding and listening to you, because it's really important. Thank you. Please like, subscribe, and share, and I'll see you for the next video. Take care.